One of the things that we can all do, men, women, all of us, we really need to focus on self-care. And this is something that I preach to every person that comes into my office, whether that be a young mom with 3 kids or a male that doesn't have any kids, but you have to focus on doing things for yourself and enjoying things for yourself. Making sure that you get adequate sleep, making sure that you are getting enough activity throughout the day, eating well, but still enjoying things that you like to do. Don't be super restrictive, but if you like that, that's fine. Just a good balance of something, just to make sure that you are in a good health frame of mind, body, and spirit. Women's health is really important because it's ever changing and it changes throughout each phase of our lives. Especially as women, we go through so many changes, whether that be from, puberty into having babies, maybe we don't have babies, just different changes along the way. And there's so many different aspects of health that we need to focus on. So finding someone to be established with, working through with them throughout the lifetime is really important. We can do preventative screenings to prevent anything that's from becoming a really big issue, God forbid cancer, but even working on cholesterol, maintaining a good weight and just being ready for any of those changes in the future, putting you in optimum health in the first place. It's really nice to have a family nurse practitioner because I can see you as a baby and then we grow together, and I know you, inside and out, so we can prepare you for that next stage of your life, getting you, like I said, in the most optimum health place that you need to be to possibly start a family or, just that next chapter of your life. Making sure that your cholesterol level look good, you don't have any concerns for diabetes, any kind of reproductive issues that we would need to see a specialist for, we can address those as they arise. But just getting all that set up with annual exams. The best part about my job is preventing things before they happen. So, routine blood work every year. I have a lot of people that tell me, I'm not sick that often, I don't need to come to the doctor. Well, I just want to make sure you can come and see me when you're sick, that's great, but I want to keep you as healthy as you possibly can be so you don't have to come see me more often down the road. We tend to do routine screenings for all women, really starting at the age of 21 where we do our first pap smear. Kind of pretty much stay the same, pap smear, labs, but once we start getting towards the age of 40, we worry about getting you screened for breast cancer with a mammogram. Age 45 into 50, we worry about, colon cancer screening. There's a lot of different options that we can do for that as well, but still continuing to check for diabetes, high cholesterol, making sure that your blood counts look good, and working that all into one visit, but getting sure all those preventative screenings are done. We go through a lot of changes just from infancy to as we get older, and one of those bigger changes that no one likes to talk about is menopause, whether that be just the uncomfortable symptoms, changes that happen. A lot of women don't have any issues with depression or anxiety, and all of a sudden, boom, menopause hits, and now they're just this whole different person. Navigating that can be really tricky. It is really nice when you have a familiar face that you can come and see me. We can talk about different things, different symptoms. I feel like I know you really well, and we can work through and give you whether that be a supplement or maybe get you referred to any kind of treatment that would help get you through that next stage of your life, because it is a big one and it's really hard for some people. But these relationships that we build over the years are really helpful in the fact that we can work together to make it a more comfortable transition.